Welcome. This subject is called the dynamics of healthcare systems. Now that's a big term and it's important, but there are a lot of interesting things that go into this subject. We'll be talking about the people, the processes and the structures that all are organised together to help people achieve the very best health outcomes for individuals and populations. If you're an Australian and you're interested in this subject, I know it'll be very interesting to you. But the Australian healthcare system is very similar to other healthcare systems around the world, and people from abroad will also find this interesting. So welcome, and it'll be very interesting to go on this adventure together on the dynamics of healthcare systems. It's great to have you on board with this subject, the dynamics of healthcare systems. My name is Mary Ditton, and I've been a patient of this healthcare system. I've been a professional clinician in both public and private services in healthcare in Australia, and I'm now an academic, and I teach and research, and I've taught and researched both here in Australia and overseas. I'm particularly passionate about health rights and health vulnerabilities. I've researched two main areas, namely the healthcare system, but also the social determinants of health, those factors that influence the population's health so very much. I know we're going to talk about a lot in this subject, and I'm very interested and excited about it because the structures and the people and the processes need to work together to have the very best outcomes. I'm very excited about this subject that's occupied my whole life, and I want to pass that on to you because I know if you're thinking about engaging in a career in health services or changing a career or seeking a promotion, I know you'll find this fascinating, as I have throughout my life. Very often when we read the paper, we hear about some of the difficulties the health system has. But this subject will show you the extent and breadth of the health system and show you how complex it is. The health system has progressed over the last 50 years to provide health care for all Australians, regardless of their financial circumstances. And this is a wonderful achievement in our society. So this subject will help you see the complexity and understand how it's evolved over that period of time. And indeed, in fact, be proud of it, as you may become part of it through this subject and learning more about it. It's reasonable for you to ask, well, what is in this subject, this dynamics of healthcare systems? Well, what we will be talking about is certainly health policy, how it's developed. We'll be talking about funding, the complex funding that's involved in health systems, what part government plays in that, what part insurance plays in that, what part of out-of-the-pocket expenses are involved. We'll be talking also about all the facilities that are involved in healthcare. We'll be talking about the hospitals, the community care, the primary care with general practitioners, the emergency care, intensive care. We'll be talking about all these facilities and structures. We'll also be talking about the personnel, the staff, the doctors, the nurses, the aides, the ambulance drivers, all the clinicians and all the people, and then we'll be talking about the most important people of all, we'll be talking about the consumers, the patients, because that's why the health system is there. The health system is designed to get the best outcomes for patients. So we'll have a great deal to talk about and explore in health systems, and it'll be a great time to learn about the complexity of it all. The dynamics of healthcare systems is a very interesting subject, and we've gone to great lengths to present it in a very engaging way for you. There are activities, discussion groups, forums, and I want you to debate with each other and with me about this learning material, issues you bring up, questions, material you see in the newspaper. I want to hear your talk and I want to discuss it with you. Later on, you may want to do tutorials. And this subject may be the beginning, maybe the entrance, and could possibly lead you to further education in health, perhaps social work, nursing, health management, a whole range of things. It could be an exciting beginning, and I think you'll find it a great challenge for you and very interesting.